The question is that the motion be agreed to, and I call the member for Fisher.
Thanks, Mr Deputy Speaker. I rise in support of this motion. I congratulate the member for Lindsay, who is doing a terrific job in holding this government to account as the Shadow Assistant Minister for Mental Health. Mr Deputy Speaker, in my electorate of Fisher, mental health issues have consistently been identified among the community's greatest concerns. According to the 2021 census data, it was the #1 health concern for men and women under the age of 55. The mental health and well-being of Australians should be a core priority for any government. I was proud to have played a role in a coalition government delivering record investment into mental health and suicide prevention, a $3 billion package, and I want to congratulate the great work that David Coleman and also Greg Hunt did when they were in their respective roles. But when it comes to mental health, we can't just measure in money invested. We have to look at the real-life outcomes for everyday Australians. And on that metric, it is clear that the Coalition is on the side of Australians. Let's take a look at just my electorate of Fisher. Since my election in 2016, I've fought to boost mental health services and outcomes. I've made it my ambition to see the Sunshine Coast become a hub for world-class mental health care. We've delivered $11.4 million to establish and deliver mental health and suicide prevention research and training through the Uni-SC Thompson Institute. $8.3 million to establish a national PTSD centre at the Uni-SC Thompson Institute, a research and clinical services centre, the first of its kind in Australia. $7.3 million to establish and deliver world-class treatment at Wandi Nerida, Australia's first residential eating disorder facility, a facility which I was advised today may have to close by the end of this year because this government, this federal government, will not continue the funding that we'd made when we set it up. And I'll say more about that in days to come. Around $4 million to create a brand new headspace in Caloundra to support the growing population of youth and young adults in the area. Over $200,000 to support NDED in their eating disorder recovery and rehabilitation efforts, and hundreds of thousands of dollars for Men's Sheds, mental health research, veteran support and volunteer mental health training. That is the Coalition's record on mental health just in my electorate in Fisher, supporting vulnerable Australians, transforming the way we treat mental illnesses and saving lives. And in less than a year, the Albanese Labor government have delivered cuts and more cuts to mental health care. We wanted a Veterans Wellbeing Centre on the Sunshine Coast. The Coalition, we wanted to deliver this. Labor said no. We committed $10 million to Fordham Australia, an organisation doing exemplary work supporting first responders with mental health support. Labor axed $7.5 million in funding, meaning that Fordham would not be able to open their outreach programs across regional Australia, including on the Sunshine Coast. It wasn't until and after sustained advocacy from members of the Coalition that we were able to embarrass this government into reversing their cuts. And now, while the country contends with a myriad of mental health concerns beyond COVID lockdowns, and in the face of a cost of living crisis, Labor has done the unthinkable. They have cut funding to Medicare for mental health care. They have slashed funding for psychologist visits by half. They claim it's based on an independent evaluation of the Better Access Initiative, but it's as if they didn't even bother to read the report, which recommends at recommendation 12 that they keep the additional 10 sessions in place. Nothing to see here. It's just so typical of this Labor government. They slash and they cut. They throw up smoke and mirrors and echo vacuous promises. Mr Deputy Speaker, I will make it my mission to ensure that this government, that it, at the very least, continues to match the funding that we did, particularly in relation to eating disorders. This minister, this health minister, seems to be totally deaf when it comes to significant and complex mental health care. And it's one of my jobs to ensure that he continues this funding. It is vital for Australians, and we'll hold his feet to the fire.